Hi, my name is Yara, and I'm gonna be presenting my Hi, my name is Yara, and I'll be presenting a case from BMJ Case Reports called the hyperglycemia due to insuloma, difficulties in diagnosis and management. So basically, this case is about a woman who kept having episodes on low blood sugar, and that they were hard to explain at first, but then it shows how challenging it could be to diagnose insulin-producing tumor. Okay, so for the chief complaint, the patient came to the clinic because she kept having episodes of sweating, tremors, and confusion, especially when she didn't eat for a while after exercising. And for history of present illness, well, she was a 48-year-old woman who has been dealing with these episodes for several months. And she said her symptoms were usually better whenever she ate something sweet or had a meal. And at first, the doctors thought it might have been reactive hypoglycemia and told her to adjust her diet, basically. But that didn't help. So the episode continued and became more frequent, even. So when more tests were done, her blood sugar was very low, but her insulin, sorry, and C-peptide levels were high, which actually didn't make sense unless her body was producing too much insulin. So, for review of the systems, other than those episodes, she was feeling fine. She didn't have any fever, weight loss, or stomach pain. And the only symptoms that were happening when her sugar dropped were things like palpitations, shaking, and confusions. For past medical history, she didn't have diabetes and wasn't taking any medications that could cause low blood sugar. And she also hadn't had any major illnesses or surgeries done before. Then for her personal and social history, she doesn't smoke or drink and she doesn't use drugs. Her diet is pretty normal and her weight hasn't changed recently. And she also works in an office, but the episode starting affecting her in work because she sometimes got dizzy or confused during the day. And then for family history, she doesn't have any history of diabetes, tumors, or any other endocrine diseases that could lead us to a possible cause. So when it came to the physical examination, she was examined between episodes and everything looked normal. But during the hypoglycemic episode, she appeared sweaty, shaky, and a little disorientated. And her vital signs were stable and no masses were felt in her abdomen. Then for the lab tests and the diagnostics, her blood test showed very low glucose levels with high insulin and C-peptides, which actually proved that her body itself was producing too much insulin. And a fasting test also confirmed this pattern. And the CT and the MRI scans showed a small 1 centimeter lesion in her pancreas, consistent with an insuloma. So basically, for assessment, the final diagnosis was an endogenous hyperinsulinic hypoglycemia caused by pancreatic insuloma. Other causes like medication-induced or reactive hypoglycemia were ruled out after this. Then for the plan and outcome, it was basically to control her symptoms. So she started on diaxoside and medication. It's a medication that lowers insulin release, and she was advised to eat small, frequent meals. And after that, she had a surgery to remove the insuloma, which is a definite treatment. Her blood sugar levels returned to normal, and she remained symptom free after surgery. So that's great. Then, for discussion and learning points, this case is a great reminder that insuloma, Even though it's rare, it should always be considered when someone has repeated episodes of low blood sugar without an obvious cause, sorry. And the diagnosis depends on what we call the Whipple's triad. So it's basically symptoms of hypoglycemia, a low glucose measurement, and a relief after eating or receiving glucose. And once that's confirmed, imaging help locate the tumor and surgical removal usually leads to a cure. So surgery usually helps for these cases. And well, these are my references. So in conclusion, this case shows the importance of staying persistent in our clinical reasoning and considering all possibilities. A simple symptom like dizziness or confusion can sometimes lead to a point, can sometimes point to a rare but treatable condition. So always have your things checked. Thank you for your time. That was it.